Good evening. My name is Shannon Pace Brinker, and I am fortunate enough tonight to be spending an hour with you talking about controlled sensitivity from our side of the chair. Before I start our program, I always want to thank manufacturers who help sponsor these programs. My manufacturer tonight is Tokiyama, and I can let you know that as a chairside assistant, I don't give webinars unless I truly believe in products that I'm talking about. And so I always want to give thanks to them because without manufacturers, these programs wouldn't be possible. And we always just want to make sure that you know that they are a sponsor and that I'm looking forward to sharing with you a very, very detailed presentation just for an hour on sensitivity. Before we start, I'll tell you that I was part of a recent study that Tokiyama did, really trying to uncover some of the factors that dental professionals really were looking for when choosing a desensitizer for maximum patient comfort. And I'll tell you that the number one really response was they wanted something for long-term relief. And I know that as a chairside assistant, I'm always hearing patients say, my teeth are so sensitive. They've always been sensitive. And so when we did this study, some of my friends, also colleagues, some of the questions that were asked to us, we were able to deliver. And really, the number one thing that we all were looking for was having a long-lasting relief and really making sure that the product that we chose was really going to work for our patients. So what are we going to learn tonight? We're going to learn what is hypersensitivity and how do we control that? How do we minimize that? We also want to know what is causing it. I mean, what are the causes of sensitivity and how can we help our patients? I think that's the most important thing. And what are some of the solutions? What are we going to do to help minimize the sensitivity? And if we can even help take some of that away, we look really good like heroes to the patient. I think that's so important. And so tonight we're just going to kind of go over a couple of clinical techniques, some of the things that I've learned over the last couple of years from using Shield Force and really just the clinical application of it. Because I think sometimes as team members we really don't understand how we can really help our patients in so many aspects and so many clinical procedures that we do every day. The first thing I want to talk about is really the definition of sensitivity. And we know that basically it's sharp pain from exposed dentin. We know that, we really need to think about the tubules and if they're open at the dentin surface, how, as well as the pulpal surface of the tooth, how do we help control that? With hypersensitivity, we know that it's temporary pain, doesn't last usually longer than 10 seconds when induced by thermal, generally cold below 20 degrees Celsius, dry, tactical, chemical stimulation of exposed dentin. And so how really can we control that? Who is it affected? Well, I'll tell you that it affects more than 40 million people in the U.S. That's a huge number. It also is common between the ages of 30 and 40. And this is what was unique to me was looking at who really are the candidates for this. When you think about it, most of the people that are experiencing this are women, young women, really younger than men. And the huge impact for me was 1 out of 5 adults. And when you think about it, it also shows patients with periodontal disease that they're really at a high risk, between 70 to 90%. So what is the cause? Sometimes we overdry the dentin when we're doing bonding. Sometimes there's cracks in the enamel, which you see this every day in your practice. Over etching the tooth. I can't tell you how many classes we give where team members have no idea how long the etch is supposed to stay on the tooth. And that can vary. One type of etch may be 15 seconds, one may be 30. I've seen some for 3 seconds. You really have to read the product that you're using because there's a lot of times where we are over etching the tooth. And so it's something that I really, really encourage every one of you to do is to read the directions. We know that there could be bond failure, and that can cause sensitivity, and most important, marginal leakage. And I am a patient that has really can talk about that firsthand. When we get to it, we think about what is it that we're looking for, what is it that we can do and accomplish with these desensitizers. We really want to think about desensitizers really are used by a general practitioner, but a lot of hygienists and dental assistants also do this. And so I think that, when we're talking about sensitivity and how we can help control it, we got to know the science behind it. This is really a detailed look at hypersensitive dentin. And with this hypersensitive dentin model, it really shows how the dental tubules fluids is really free to move within the tubule channel. So the non-hypersensitive model on the bottom plugs the fluid from the really exposure, eliminating discomfort whenever we are using the Shield Force to help control this sensitivity. And we're going to go through this step by step to help you understand how that works. So basically, what are we trying to do in a nutshell? We're trying to desensitize the nerve, make it less responsive to stimulation, and plug those dental tubules, preventing fluid flow. When we look at some of the products that we've seen and what's been used on the market, and I really, don't say anything bad about products. There's so many great products out there. I just know from my own perspective some of the products, and when I look at studies and I look at materials that have been used, I really want to make sure that we look at, there's several other types of desensitizers out there. With dentin and enamel are each composed of high concentrations of calcium hydroxyapatite, which is the alkaline in pH. And so we look at various types of materials and how they're used. What is really different about some of these products is, with Sensodyne, one of the things that I hear so many patients, they'll say, well, I use Sensodyne, so it really helps desensitize my teeth, and I understand that. But what I want you to understand about Sensodyne is it's great. It's great for, the aid of helping desensitize the teeth. But what I tell my patients is, when you're brushing, you rinse, you're basically only getting a small amount of that potassium where we really need it. And then when we talk about Gluma, Gluma is a very, very good product. I've used it a lot in my practices, but it does have glutaraldehyde in it. And so we do worry about, tissue. I've had some hygienists come and question about that. So there's some things about the Gluma that I want you to really think about. And so also with Vanish, Vanish XT is probably one of the leaders in fluorides and things that we're placing on the teeth, but it really it is a good product. But when we look at the Shield Force, there's a lot of properties that it has that the rest of these products don't. And so I want to just kind of share with you the difference between that and those other products. Shield Force really, when it's applied to the tooth, we know that it's going to cause the material to really collect the dentin tubules and apply it on the surfaces. It's a little bit different than just taking your brush and applying it to wherever there's sensitivity. You really have to not only air dry it, but you're going to light cure it. And we're going to talk a little bit about this product and what makes it different than some of the other desensitizers you may be using. When the water and the solvent evaporate after you place it, you're going to air dry really good and air dry it really, really strong. What this is going to do is seal the dentin tubules, and the hypersensitivity is going to be reduced and eliminated. And what we do with the light is we're going to light cure that, light cure the material from all sides, and we're going to make sure that that's linked and polymerized to form a durable layer. So what is the difference with Shield Force? When you look at what is the difference, it's really a big change from what we're used to using in our practices. Shield Force really penetrates deep down into the dentin tubules. It's sealing the dentin, and again, making what we call a double block effect, because it's not only sealing the dentin, but once it's light cured, it's really, really stable. And I'll tell you, immediately we've had patients who have sensitivity just completely eliminated. So let's talk about some procedures, because again, I want to make sure that you understand all the variables in your practice, all the ways that this desensitizer really can help your patients. First thing we want to talk about is just what we call dentin sensitivity, hypersensitivity. How can we coat the cervical areas where we have abfractions? We may have recession. We may even have areas maybe where it's old restoration and the gums are starting to recede a little bit, and we need to help our patients with that sensitivity. In our hygiene department, we have a lot of our hygienists will actually apply this before our cleanings, before they even start. And that's really, really a great scenario of using this product. But we want to start really by how we seal the tooth, whether we're going to just place it right on those exposed cervical areas or we're going to place it on an area where we've prepared the teeth. Let's first start with an anterior tooth that we did. We had a patient come in with some old bonding, And the tooth was really, really sensitive. And after we removed the old bonding, we were able to get down really to the natural tooth, a very, very minimal preparation, which was really nice. But the patient said, she still had a lot of sensitivity in this area. So when you etch, again, I can't stress enough, be real careful not to over etch. Know the material that you're using, whether it's Ultradents, whether it's this one here happens to be Kerr. You want to know that product because they are very, very different. And I'll tell you, as an assistant, I really never thought about that. I thought they all were the same and had the same working time. They do not. So make sure this could be the very first start of sensitivity for a patient. So we're going to place our edge. We're going to rinse that off. We're going to dry it really, really good. And this is where we're going to use our Shield Force. And I'll tell you that my doctor likes to put it on a brush. We love these little Pinnacle brushes from Total Care. We use it because we really want to make sure that we coat the whole entire tooth. In the packet, it's going to come with little micro brushes. Some doctors like those. But I'll tell you, my doctor likes to, he just slaps it on there, really coats the tooth really, really good. Every time we etch any restoration or for any direct composite, we're going to apply a desensitizer. What I love, too, is he's also communicating to the patient that we're doing this. And so the patient knows that we're taking that one extra step to minimize sensitivity. I think that's really, really important as you're doing things to explain to the patient the process. There's a lot of doctors that don't do this. And so I would encourage you dentists who are on the program today to really explain to your patient what you're doing and why. So we're going to suction this off. I put my suction right up there to make sure that I can just remove the excess. Then we'll take an air water syringe, dry it really, really, really good, and then light cure it. So I'm going to suction first, and then I'm going to dry it off really, really well, and then we're going to light cure it. It's so easy, and now you can just go straight to your bonding agent. And so, again, we'll etch, place the Shield Force, and then go to our bonding agent. So that's just one way of how we use it. So let's talk about some other areas. Here's a patient that came in that had some pretty rampant decay. As far as the treatment plan went, we want to really look at what the patient, where he wanted to go. He really wanted to start with one side of the mouth first. Was someone that couldn't even hardly drink anything that was cool. He always had to drink beverages that were warm. So we knew right away that, by just going through the bonding process, it may really, really affect the sensitivity even more than what he was already going through. So I think that this is something that you really want to look at way ahead of time. When we do a consult for a patient, I'm always questioning the types of sensitivity. What are some of their habits? What are some of the things that they're doing? Because I think that that is something that we really, really want to make sure, that we do. Now, I'll tell you that I will answer every one of these questions as soon as we're through, because we're going to save some time just for that. So I will be going back to those questions that you have. So feel free to do that as I'm going through, and then I will go back and answer each one of these. So first thing we're going to do is we're going to place an Optigate and really isolate the area. And we're going to look at those areas where we're going to be placing the composite. So the first thing that Dr. Orr did is she placed a little bit of cord. We wanted to, first of all, control hemorrhage. We also want to make sure that we push that tissue back just a little bit, removed all the decay, had a lot of tooth structure left, and we decided to go with the direct bonding because she's very, very conservative. I really like that about her. We're going to acid etch the teeth. This is Ultradent's product, and it's a 30-second acid etch. So we're going to do that for 30 seconds. We're going to rinse it off really good. We're going to apply our Clear Shield. Now, she likes to use a little micro brush. She uses that for everything. So we're going to place that. And again, she's also very, very generous. I work for 4 dentists in my practice. It's amazing how funny they're all very, very different. But I like that about them. But they all do the same type of procedure. So this is really nice. And she likes to use a micro brush. So no, either way, just depends on whatever your doctor wants to use. But she, again, will place the same amount of coats, usually about 3 coats of the Shield Force in those areas, and we're going to place that on both of those teeth that have been prepped for the direct composite. Once we do that, again, we're going to dry it really good. I'll suction off the excess because they do place 3 coats. We're going to suction that off. We're going to dry it really, really good, and then we're going to light cure it. Place our matrix after that. We're going to place a little wedge, and then we're going to go right to our bonding resin. We've got our bonding resin on there, and now we remove got our bonding resin, we placed our composite, we finished that down, we removed the cord, we removed our matrix and our wedge, and now we have a final restoration that really looks nice. I'll tell you the great benefit about the Shield Force for this patient was immediately the patient was like, wow, this looks really good. And I said, well, the tall tale will be whether or not, you're going to have sensitivity. So we're going to see you in a few weeks and come back and do the other side. So I think that is really, really important. So we want to make sure that when the patient comes back, we really just monitor that. But I can tell you that right away when he came back, he was ready to do the other side. He said, you know what? It's not even about the fillings on these teeth. It's about the sensitivity. I am so surprised that it's subsided. And so we were really, really, really happy with that. So that's something that I want you to really think about. I know there's been some questions, when the patient's already sensitive, is this going to, by placing edge and doing the right composites, is that going to make it even more sensitive? Remember that we're going to etch, rinse it, and we're going to put the fluid right back into those dental tubules to seal it, to help with any sensitivity right away. That's what's so great about this product. Let's talk about lower canines. Here's another restorative. This patient came in, broke off the canine, had basically a severe bruxer, had a lot of wear, a lot of areas that we knew were going to have to be restored. Did not have the financial means to be able to do any kind of laboratory fabricated restorations. And so for now, we're going to replace all the areas that are worn, all the areas he may have chipped, and try to put back those edges so this way the bite is so much better. And so that's something that I think you'll see here. Really, really important to think about, again, being very, very conservative. I'm all about that. When we acid etch the tooth, again, doesn't matter to us what type of materials you're going to be using. Here's Ultradent Etch again. I like this little spiral brush. I think that's something that they're kind of known for, is all the little brush tips for you assistants out there. This is called a micro brush. I love this. I now have switched. I use this all the time just because of when I squeeze the edge out. Sometimes we have those needle nose tips. It'll go everywhere. I really want to control where that edge is going on the tooth. And so the great thing about these little micro brushes is it makes it so much easier to do that. So we're going to basically just squeeze some of that out on the area. Rinse it really, really good. We're going to dry the tooth. Remember, as soon as we dry it, we're going to go right to our Shield Force, again with a micro brush. 3 applications is basically what my doctor does. And then we're going to suction off the excess. We're going to dry it really good. You can see we're going to dry it really good, and then we're going to light cure it, and now we're going to go straight to our bonding agent. Let's talk about the bond strengths and how this really helps the bond strength. I think that that's always a misconception. Is it going to inhibit my bond strength if I'm going to utilize this product or this material? And I can tell you, no, it will not do that. It's something that we do recommend whenever you're using this for any kind of indirect restoration. We want to make sure that you are including this product in that. One of the things that we know is you're going to dispense the product. You're going to apply the Shield Force, leave it for 10 seconds, apply a very, very light, weak air for about 5 seconds, and then a real strong. So you always want to remember that the application, you want to go really, really slow with the air, and then really, really powerful with the air. So I just gently, that's why I always suction it first. I kind of suction a little bit off the excess, and then I'll slowly dry it, and then really put a forceful air dry on the tooth. We're going to light cure it, and then wipe, any kind of smear layer with some alcohol. But I'll tell you, I just don't see that. One of the things that I do is I'll dry, like I said, by suctioning it off, and I think slowly drying it and then aggressively putting the air there, we just don't see any kind of, any really layer of alcohol that we need to really place. There's been only very, very few times where we've had to do that. So here, when we talk about a provisional, it's the perfect restoration for this product. I know that as a dental assistant, it's really, really important to think about sensitivity, with composites, with cervical areas. But I'll tell you, this is really where I come in. Because for me, when I'm making all my provisionals, this is a step that I always do, and I tell the patient about this as I'm doing. I can tell you that I don't know if it's because I tell them that I'm doing this, but the sensitivity is so minimal. And so again, encourage you with that verbiage to explain to the patient, first of all, the procedures and what we're going to be doing. So when my doctor's finished prepping, I always come around, of course, and sit in her chair, and I'll talk to the patient about the procedure, what I'm going to be doing. And I'll say, Mrs. Jones, before we start with your provisionals, I want you to know the steps that I'm going to go through. The first thing I'm going to do is fabricate your provisional, and we're going to trim it and polish it and make it really beautiful. But I will tell you, before I submit your provisional, we're going to place a desensitizer that's really going to help. We've really been using this product for almost 2 years now. It's a fabulous product, and what we've seen is our sensitivity has almost decreased by like 90%. I can tell you that hardly any patients come back and tell me they're sensitive in the provisional stage. And so if I can get that in my provisional stage, it makes me look like a rock star. And so I really like that. So here's what we're going to do. We're going to fabricate our provisionals. I've got my provisional material started here in my clear matrix. You can use a putty matrix. I use both in my practice. We're going to seat that. This happens to be a coping stent. It's a 0.20 coping stent. We're going to load the provisional material right into there. We're going to seat it, let it set up. Take off the coping stent, and I'm going to remove the provisional. I'm going to trim it and polish it, and yes, I did get a little disc happy there between 8 and 9. I like to use disc. I really want to open up those embrasure areas, but I'll tell you, this is what's really important because I'm opening up those embrasure areas with disc, and so I really want to make sure that I tell my patient, these are all going to be splinted together for strength, but we want them to look like single units, and that's something that's really important. The one thing I can tell you by opening up these embrasure spaces is that you do have to be really careful because the patient will have a little bit more sensitivity in those areas. And so if you're not, again, using something to help with that, I think after tonight, I hope that you'll do that because I know being a patient myself, when I had my teeth prepared, they were very sensitive. And I've got some bridges, crowns, and inlays and onlays. I've got every type of restoration pretty much you can think of in my mouth, and it was very sensitive, really, especially after the first couple of days. So I want you to really think about that. So anytime you're going to really remove those interproximal areas like that, we know that food, saliva, things that we drink are going to surpass right through those provisionals. They're really thin. It's just acrylic, and it is going to shrink and contract and absorb fluids. So just kind of keep that in mind that everything the patient's going to eat or drink, whether it's cold or warm, is going to come right through these provisionals. So that's why this is really important to think about a desensitizer at this point. A lot of times in my practice, we'll use a conventional cement for our restorations. But the one downside about a lot of provisional cements out there is that they're white. And so when we seat the provisionals, I really hate that because a lot of times the cement will shine through and give the patient what we call the moon tooth. So I remember when I had my teeth prepared, I did not want that because I didn't want them to look opaque, kind of fakey white. So in my practice, we like to use a flowable composite. We'll use a resin, or we'll use a clear cement. And so for this patient, our technique for this one is going to be we're going to spot etch one little place right in the center. And I'll tell you, you don't want to spot etch the whole tooth. It's going to become a permanent restoration if you do that. So I encourage you, don't do that. We're going to etch those areas. We're going to rinse it really good. Okay? After 15 seconds, this is a 15-second etch. Just right there in the center, one little dot. We're going to rinse that off. We're going to dry it really good. Make sure those areas are really dry so I can see the frosty appearance where we place the etch. And I'm going to place my Shield Force right in those areas. Again, I told you I like to use a brush. My male doctor in my practice, Dr. Etheridge, likes to use a brush. So we're going to go through with a pinnacle brush and really place a lot of this material all around the tooth. He slaps it on everywhere. I'm almost like, wow, you don't need that much. But I think it's just because he just really wants to make sure that every place on the tooth is completely covered. We're going to dry that really good. And remember, we're going to start with just a light flow of air and then a really heavy handheld air. We're just really all forces on that after I suction. And then we're going to light cure it. We're going to place a little bit of flowable into our provisional, and we're going to seed it. I'll tell you, I don't worry about my bond strengths. I don't worry about the inhibitor of the Shield Force because I'm light curing it. I also have questions sometimes of team members asking me, does it hold the restoration up? Is it Does it have a film thickness to where, you can't see things all the way? No. Never ever had that, whether it's a provisional or a final restoration. It's a very, very thin coating. When we dry it really good, when we suction off the excess, we do a light air, and then we do a strong air. We just don't see that. And if you do see that when you're seeing a final restoration, again, that's where you're going to go to your alcohol to help remove any of those layers. So once that's down, we're going to hold it down all the way. We're going to remove the excess of the resin, and we're going to hold it down with our instrument, and we're going to light cure it. So that's basically, we know that these provisionals are sealed. We'll go through and remove any resin, polish it really well. We've gone through some polishing steps here. This is our Jiffy system from Ultradent. It's my favorite. And then we're going to apply a glaze. I do like for my provisionals to look really lifelike, so I do like to use a glaze. This happens to be Voco's glaze. I really, again, like to use the glaze because I feel like it makes it look like a real provisional. We're taking the patient through all the steps, and I'll tell you, I've had so many patients say, wow, you guys take so much time, you take so much care in all the steps that you're doing. And I said, listen, my family comes here. I'm a patient, my family's a patient, and we treat every patient this way. So a lot of extra steps for a lot of things that we do, but again, it really pays off in the end. So we're going to place a little glaze, we're going to light cure that, and here's our final provisionals. And so this patient's going to go away for about 2 weeks, come back and see us, and I can tell you when they come back, you know what my first question is going to be. How was everything? How are your provisionals? I'll tell you that I will call them that night to check on them, whether we delivered several final restorations or a huge case like this. I do, as an assistant, take pride in calling them, make sure they're okay, make sure that they know that I'm thinking about them. And I'll say before I leave at the end of the day, I just wanted to call you really quickly and make sure that you're doing okay. If you need me for anything, you feel free to call me. I always give the patient my card, let them know I'm here for them. But again, I want to make sure that they've been taken care of. So when they come back in about 2 to 2.5 weeks, they'll ask me right away. First thing I'll ask them right away is, how are you feeling? What did you think about these temporaries or these provisionals? And they say, wow, Shannon, you know what? You were right. I can't thank you enough. And I say, well, did you have any pain? Have you had any discomfort? Were you able to chew and eat and all those good things? And because I'll tell them with the provisionals, be real careful drinking something really, really cold, because with cold they shrink and contract. It's an acrylic material. With warm drinks, they're going to get really loose. So I really try to encourage my patients to drink things at a warm temperature. But I'll tell you, I don't really worry about that anymore with this product. And so it makes it really easy if there's something that I forgot. A lot of times they'll come back and say, no, I had no sensitivity. And so we found that as we explain to the patient the procedure and the steps, they really, again, appreciate it. Here's another provisional case that we did. Very, very minimal preparation, but we still want to take, the time to do all these steps. And I can tell you that some people say, well, Shannon, your doctor is so conservative. This happens to be a case done by Dr. Nash. And he's a very, very conservative doctor. We did 4 veneers on the top and 4 on the bottom. We still went through the same process. We acid etch the teeth. It doesn't matter to us whether you use a dot, you use a little landing strip. It doesn't matter. We're going to rinse that off in about 15 seconds. I like to use a suction tip that has a rubber end to it. And so it's something to think about. This is from SafeVac. It actually now has colors, so you can really control suctioning everything. It really grabs, but also doesn't cut the patient. So I'm going to rinse that off. And again, going back to that Pinnacle brush, we are going to really use it to place our Shield Force on all the areas that we etched. Make sure it's really covered. We're going to go with a light air, a strong air, and then light cure, and then we're going to go right to our flowable again. We're going to place it in the inside of the provisional. Take a little brush and just kind of brush the flowable all around those areas, seed it. Remove the excess flowable with a brush. You can use any kind of brush, you can micro brush. This happens to be a number 2 artist brush from Keystone that we're going to use. So I'll remove my flowable composite, make sure all that's off of there, even on the lingual. Light cure it, hold it down, light cure it, and then we're going to do the same thing on the lower. We're going to etch those areas, rinse it really good. Going back to our desensitizer, making sure that we really apply it in all the areas. We're going to suction off the excess really well, dry it, light dry, heavy dry, light cure, go right to our composite again. Unfortunately, sometimes we have provisionals that break in half. That happens. Great thing about flowables, you can put it right back together again, right? So we're going to just add our flowable there. We're going to seat it. Seat the other piece. Remove our, again, access here. Holding those areas down, really cleaning up the access. And now we're going to light cure it. I'll take an air water syringe and kind of go through all those interproximal areas, making sure that I didn't miss anything. And then again, holding that down, and then just going through with a light and light curing it. The patient is very, very happy with these. I'll tell you that what's ironic sometimes is the most minimal preparation sometimes can be the most sensitive restoration. And so I really want to encourage you to think about that. There have been patients who have came back after we've seated really thin, contact lens veneers, luminaires, the thinnest amount of porcelain placed on the tooth. Sometimes the patient will come back and have the highest sensitivity. Doesn't that just blow your mind sometimes? Or the tiniest filling, the patient is just dying. And so there's a lot of times what we see with these final restorations when it comes to these minimal veneers is that there could be a couple of things. First of all, we may have over-etched, which we talked about, and then we may have not put enough of the desensitizer, enough of the bonding agent. So we want to encourage you to do that. Again, having the Shield Force first, light curing it and then placing our bonding resin, we're getting a double seal here, and that's what I want you to really think about. When we fill our restoration with our cement, we're going to place it, but I'll tell you that one of the things we've also found is over-curing the restorations. One of the doctors that I used to work for had basically heard this from another clinician where you could take a cure light and cure it from the facial and then take another cure light and cure it from the lingual. So we would call that a double cure technique. I would tell you don't do that. We had several patients coming back that were just dying of sensitivity. They couldn't hardly floss the teeth. So, we never, ever want to do that. You just want to use a one cure light, whatever type of cure light it is. You don't want to double cure because that can really make the tooth very, very hypersensitive and really cause the patient some pain for a couple of weeks. Some patients have had sensitivity for a couple of months. And so, guess what? We never do that again. But one of the things that we know now is it makes it much, much easier on us if we just follow this same protocol, apply the Shield Force, apply the bonding agent, apply the cement, and then cure it with just one cure line. So, I always want to talk about the things we do right, but I most importantly want to talk about the things we do wrong. So, want to encourage you to be careful with that. And again, really nice provisionals. We take all these extra steps to make sure that no matter what we're doing, the patient has been taken care of. And we treat every patient just like it was family, and going through all these extra steps. We don't want you to cut corners. You want to provide the very best for your patients. That's what's going to keep them coming back and keep the confidence in you. Because one of the things that we found in our practice, my big practice, is that, patients will blame us for things that happen, and it could be things that they were already going through, or their teeth, they're the ones that have fractions of wear and fractures in their teeth, and their bruxers, their clenchers, recession, all those other things. But, as things happen when we place restorations, whether it's direct or indirect, anything that we can do, of course, now it becomes our fault. So we do this as a Band-Aid. We just always want to back ourselves up and make sure that with any procedure that we're doing, we're covered. Now, let's talk a little bit about restorations because, anytime we're using a cement, and I love Ivoclar. Ivoclar has some fabulous cements. We use a lot of Ivoclar. We use a lot of GC products. But here we're using Multi-Link, and we love that product. But I can tell you that a lot of doctors will tell us, why do you use the Shield Force if you're using the Multi-Link A and B bonding agent? You really don't need that. And we said, listen, we just don't cut corners. We follow the same protocol. So even if we're delivering a crown, a veneer, an inlay, an onlay, a bridge, no matter what it is that we're doing, we still follow the same protocol. So the first thing that we want to do is we're going to remove the provisional. We're going to clean the area really, really good. I do use pumice, so I know that sometimes the patient can be a little bit sensitive. I want to make sure there's no residue from my provisional cement. So I'm going to pumice the tooth off really, really well after I remove it. The other thing is patients will say, well, how are you going to clean this? So that's always the first step. We do get our patients numb, so that's something that you don't have to worry about. The patient is numb. Once we remove the temporary, we will go ahead and anesthetize just a little bit, something really short acting, like Carbocaine. So I'm going to pumice the tooth really good. Sometimes we'll place a little bit of cord. This happens to be Ultradent's cord, and Ultradent's really, really great cord packer. And we're going to place, our Shield Force. So one of the things that we'll do is we'll just place it right on the tooth and all over the tooth. Want to make sure that we cover it really, really good. We'll go to our bonding agent, and then we'll load the crown or the restorative material with our cement and put it right on top. So the procedure for this one is going to be followed by basically going right into placing the Shield Force right on the tooth, dry it. We're going to suction off the excess, dry it really good, light cure it. Then we're going to go straight with our bonding agent, and then also in with the with our cements. So something that we really want to look for. So just keep in mind, again, so many great cements out there, but we always follow the same protocol for every type of restoration that we're going to be seeding. Now, let's talk really, really quickly about this patient. I will tell you that this patient, I really, really made some shortcuts. I really cut corners here, and I show this because not everything we do is perfect, and I want to make sure that if you have a patient like this, that you're really looking at that, because she came into our practice really wanting to do some whitening. And she said, I've been through ortho. My teeth are really, really short. I really want to have, some length put back on my teeth. But before I decide to do that, I want to be as minimal with the restorations as possible. So I'd like to whiten my teeth first and then go forward with the final restoration. She, again, had already gone through ortho. And, I just said, yeah, you know what, you're a great candidate for this. I think you're a great candidate for whitening. And I will tell you that I did not look at her x-rays before I started the whitening, which was totally a no-no. I should have known right away. And if I go back, you look at the teeth and how much tooth structure is really showing, this should be a red flag for you right away. Okay, so always, whenever you're doing whitening, if you have teeth like this or have a patient like this, you want to look at the x-rays. What I want to really bring up here is notice the pulp. When you look at the pulp, and again, I'm not a dentist, but I do a lot of whitening in my practice. I'm kind of known as the whitening specialist in my practice. I should have known better. I should have looked at this first. So the first thing that I did was we went right into whitening her that day. She wanted to come in. She wanted to get her teeth whitened. I said, I had the time today. Just so eager, wanted to jump right in. And I'll tell you that I did not use any type of desensitizer, not thinking that she was going to be sensitive. So the first thing that I did was I went ahead and I put my gingival barrier on. I put my in-office whitening on. I don't use a lot in my practice. So at this point, I either use Ultradent system, which is a boost, or I use Venus, which is their system, which is the Venus Ultra or the Venus Max, excuse me. So both of those products are really what I use in my practice. But I don't use a cure light or a light to basically activate it, because those don't need a light. But my patient still had a lot of sensitivity. And I remember her leaving. She was perfectly fine. And she called me that night. She said, Shannon, my teeth hurt so bad. And she was almost in tears. I felt like a dog. I mean, I really, really felt bad. And I just didn't quite understand why she was so sensitive, because I've done hundreds of whitenings, and I hardly ever have patients have any sensitivity with either one of those products. And so I went back the next day, and I talked to the doctor in my practice, and I said, I don't understand why she was so sensitive. I said, I know her teeth are really short, but I just didn't get it until we sat down together with her, and we were looking at her x-rays and looking at things, and I said, oh my gosh, the first thing I should have thought about was her ortho. She'd gone through ortho and moved these teeth, so that's going to be the first thing to be a red flag for you, is they're probably going to be sensitive. The second thing is I went right into an in-office whitening without using any type of desensitizer, not thinking, because Boost has potassium nitrate in it. So I automatically just assumed that was going to be the best product for her, which is a very, very good product. But I didn't really pay attention to this. And so when I pulled it up, and I was talking with Dr. White in my practice, and I said, Dr. White, oh my gosh, I didn't look at the x-rays. And he said, Shannon, I didn't even think twice about it. And I said, her teeth were hurting so bad. So the next day, I had her come in, and I said, I am so, so sorry. I said, Nicole, I would have never hurt you for anything. I said, most of the time we do whitening, the good thing is it's only going to last for 24 hours and it's going to go away. But she was miserable for 24 hours. And so I told her, I said, if I would have even thought about this, I would have had you come into my practice. I could have saw you that. I would have just came in and see her that night. Because immediately I would have placed this. And so I told her, I said, I want you to come in the next day. I said, first thing in the morning, come in and see me. I'm going to use this Shield Force. And I'll be honest with you, this was my very, very first patient I had ever used this product on. And so I told her, I said, I'm going to put so much of this product on there. We're going to make sure that this works. I just really feel bad. And she said, no, Shannon, trust me, it's okay. But again, I just thought about her all night. I couldn't even sleep all night. You have those patients in your practice. So I'm going to place the Shield Force on all the areas that were sensitive. Mainly, they were sensitive from canine to canine. And same on the top, from canine, you see that she's missing a lateral. So the canine, the centrals, and the lateral on the other, or excuse me, the canine on the other side, really the front four were just so super sensitive, but hypersensitivity on the lower 6. And so I want to really place that all over those areas. I, dried it, suction off the excess, barely dried it first, started slow, and then gradually got really strong with my air, and then I'm going to light cure those areas. And again, I really put a lot of material. I just coated it all over the place, And I told her, I said, I know this tastes bad, but I can promise you it's going to work. And so used it all over those teeth. And I'll tell you that after a few days, she came back and she said, wow, you know what, Shannon, you remember where I started when I came in? Because when we do the boost or we do any type of in-office whitening, we give our patients home trays. And so I want you to know that that is always a protocol. I told her to wait 24 to 48 hours to start the whitening because I was so scared she was going to have sensitivity. So the day that we did the whitening, we had to wait a few days for her to start her home bleaching. And she was able to do it every day for a week. Every day after that. After I placed this product on her teeth. And so that to me was seeing is believing. So she went home. She started doing the whitening at home. She did it for an hour a day for a week. And she said, Shannon, you know what? I started in A3. And I said, well, let's see where you are. Because one of the things I always do is when the patient comes back, I pull up the first photo of when they came in. I took the shade tab. She was an A3. And just in 5 days, she's now an A1. And so it was amazing. I said, did you have any sensitivity? Tell me the truth, because I know that you will. And she said, if I'd had sensitivity, I would have called you from day one. And so I was like, wow, you know what? I am really impressed. I'm so happy. I said, this is my protocol now for all my patients. I just don't even take the chance. I'll tell you that I've been using both those products for a very, very long time. But this is just an added benefit to all my patients. And I tell them that you know what, before we even start, especially on my teenagers, I do a lot of whitening on teenagers. I just want to make sure that if I have an instance like this patient, now Grant, she's 37 years old. So, her teeth, are very different than most of our patients. But my younger kids, I want to protect that pulp. And so I want to make sure. So every time I do whitening now, I look at those x-rays. But I'll tell you that this is just a protocol. It's something that we put together that we do for all of our whitening cases. Now, really, how does this work? And it's something then just to go back, Shield Force really, really penetrates into those, little resin tags and really creates a barrier against fluid. That's what really makes a difference. Notice the resin tags are created by Shield Force on the left, and then you look at the right picture shows the top coating layer, which really what covers and creates that double block effect. So you really want to place a lot of this product on the tooth, dry it, and then light cure it. I really think by light curing and having a desensitizer that you light cure is what makes the difference. So again, you say, seeing is believing, but as a patient feeling this, it's night and day. So want to just take you through that. And then here, you want to notice how Shield Force really fully goes into the tubules very, very deep down versus some of the other materials that you may be using out there. So just want to always show a little bit of data for those areas and just give you, some scientific materials here for that. When we talk about placing with other different desensitizers, this was basically a thermal test that was done with the Shield Force versus all the other materials that are out there. And I'll tell you that Shield Force really protects the tubules for a long-term resistance and sensitivity. After 10,000 thermal cycles, this is what you'll see. So we were really lucky to see this in our scientific data and a lot of the studies that we were doing. Big deal. You know, when we talk about all these other things, when we go through and we talk about scientific information, you know, Tokiyama has a whole R&D department that really conducted just toothbrush abrasion. And so after 10,000 strokes, we noticed that Shield Force really decreased a normal 1.5 versus all the competition, everyone out there. So even just from toothbrush abrasion, this was a very big deal. This is something that your hygienist can do right there at the chair. In our practice, I'll tell you that we do charge. I know there's a lot of questions about what do you charge. There is a code. I always refer to Charlie Blair in his CDT book, but there is a code that we use. Unfortunately, I don't know that right off the top of my head, but I can get that for you. There is a desensitizing code, and in our practice, we charge $15 for this. And you say, wow, that's really low, but I'll tell you that we do charge for patients that are in hygiene. I don't charge for my patients where we're doing restorative work because of the fact that it's just part of the process. I also don't charge for whitening. So the only time that I do that is in the hygiene chair. And again, that goes on hygiene production. So it's just something to really think about. $15 is a great fee. I mean, we get this all day long. So if you're talking about production, you think about the end of the day, this is one of our cash producing items because we're constantly doing this throughout the day in all of our laboratories where we've got hygienists working. So it's a great product for hygiene. And then last but not least, you know, just again, compared to some of the other competitors out there, we just saw a decrease substantial in our, when we go through back to our toothbrush abrasion, long-term patients, you know, very happy with the overall sealing of all these dentin tubules and all these areas really where toothbrush, you know, really has been done and actually some abrasion areas there. Now, when we go back and we look at the cost of what you're dispensing here, you want to really think about just what the patient is going through. A kit of the Shield Force runs about $119. People always ask me this, so I always want to put in what does it cost, what are we going to be looking at. A whole kit is $119, and that's with the bottle. You get a little dish that you can just really wipe out. I just wipe it down with a cavity wipe, and you get 25 applicators. If you say, you know what, I already have applicators, which my doctor likes brushes, my other doctor likes micro brushes, pinnacle brushes versus micro brushes, it totally doesn't matter to us. You may just need to order the refill. But I like it in the bottle form. I think that's really great because I can dispense it as needed and just be really careful. The other thing that I like is the dispenser because a lot of times when we unscrew the top and we squeeze out, you know, any kind of product that's in a bottle, especially bonding agent, it'll go everywhere. You're like, oops, I don't want my doctor to see that because that's very expensive. It has a controlled tip on it that allows us to just squeeze out one drop, and I can tell you that you can be very conservative. A little bit goes a very long way. So again, just want to put that in there for you. I can tell you that I always want to disclose that I own a magazine called Contemporary Product Solutions. We evaluate a lot of products really from the team perspective. Our team of hygienists, assistants, doctors, and office team members have evaluated this product. It received 4.5 diamonds. It's a very good product. And also, if you go to our website, there's lots of ways of requesting samples for all various types of products that we offer, free samples, but also you can get the handout for today. A lot of you have asked about my provisionals, about whitening. We have a lot of things on our website that I encourage you to go to look at. I teach a lot of classes. I'd love to see you again, and we do a lot of webinars here on Viva Learning. So I always appreciate them having me. I have to give thanks to my magazine and to, most importantly, Tokiyama for really believing in the team. Again, very different webinar tonight. It's really from a team perspective, and I don't talk about any products that I don't believe in. It's something that I have a reputation for that I have to protect, and so with this product, it's just part of my protocol for everything that I do in my practice. And again, I just know it works. I don't need the science when I got the patients to tell me that sensitivity is gone. And so I want to thank you. I want to thank you on behalf of Viva Learning, and we hope to see you again at another webinar. Before we leave, I want to just kind of go back a little bit. I had so many of you give me so many questions, but also give us such good feedback. I really am happy to see that a lot of you are already using this product in your practice. Is it necessary, one of the questions, is it necessary to place a matrix band between adjacent teeth to prevent bonding to those teeth? It really isn't necessary with a desensitizer. Remember that this is a desensitizer first, but if you have interproximal areas that you're going to be placing composite, you want to etch the tooth, rinse it, apply the shield force, suction off the excess. You want to dry it really good, slowly, and then go to a gradual, really forceful air dry, and then we place our matrix and our wedge. And you notice that the step by step. So that's something I really want to touch on is go ahead and do all that first, and then when you're ready for your bonding agent, before you put that on, that's when you want to place your matrix. Basically, 100%, the tooth is already sensitive, so we etch it first before shield force. Yes, you do, because remember, we want that to go right into those dentin tubule areas. Without etching it, you might not get as much impact. It's called a double force impact. So you will not have that. You do have to dry it. We want to desiccate the tooth, so this way we know it's really, really dry. But remember, we're going to go right back with the shield force to close all those dentin tubules and to really just go right into the tooth. So really, really important. So that's something I want you to really think about. Let's talk about another question here. Just kind of go, what's the ADA code, especially under a composite? Are you charging out for an additional code for that? Not under the restorations. Remember, not for my provisionals, not for my final restorations, because the patient has already paid us, $1,100. So I don't do that. That's just an added bonus. When we're doing whitening, I don't charge for that. But if I'm doing, something at the chair in hygiene, in fact, my hygienist, all of my 5 hygienists in my practice use this, they will charge. And I can definitely get that if you want to email me. I can definitely go through. I had another question about, making provisionals. We've done some provisionals here on Viva Learning, so please look us up. We have a lot of products that we talk about. A lot of cements that we go over. So again, this is just a tool. We want to go through procedures. I like to talk about all the various types of procedures, how this can be used, but I also want to make sure that you know some of the products that we're using. So check out those other ones out there. By the way, how can you air dry a tooth that is sensitive to air? Great question. Remember that we're going to dry it after the etch, but we're sealing it. We're sealing those tubules. And again, I can't say enough. Once you do that, you're going to see a dramatic decrease right away, okay? So you're going to see instantly patients are going to leave and say, oh my gosh, this was really, really works, and that's really what makes us so exciting. So I think that is something that I really want you to think about. The company that carries this product, I didn't go through that a whole lot, Tokiyama. Tokiyama has so many great products. You'll see a lot of Frank Spear talks about their beautiful, beautiful composite Estelite, and they have some great, great other products. I'll tell you, this one just happens to be my favorite, and so I do want to mention just thank you to Tokiyama. They're the persons that the manufacturer that really, really brought this. If a patient complains of sensitivity because of occlusal abrasion, then again, you can use this in the same thing, same way. Application is always, always the same. Nothing changes. So, not sure if it's any more questions. Let's see here. What's the ingredients in the shield force? That is really, really a good question. I'll tell you that it's something that I'm going to go back to really quickly because I want to make sure that I give you all of that because I know sometimes that is a question. What is in it? Let's just back up here because, again, scientifically, I want you to know what is in this product. Because as an assistant, those are a lot of questions that we have. When we talk about all the science and all those things, it's something that I really don't talk a lot about because, again, that's outside of my area. But I'm going to get you that answer here. Let me go back. I'm just looking for that, so we'll know exactly what's in that. Unfortunately, I don't really see here what we've got as far as all the information of what's in it. Let's see. Yeah, I don't really see that here. I just know that we go through all these areas, but that's not something that you can't find out yourself as far as what are the chemicals in that product. So I can get that for you if you want to email me. I'll be more than happy to answer that. I had one doctor say he really likes the Estelite. I do too. I tell you, Newton Fall would not put his name on that product if it wasn't good. As far as getting the subscription to our magazine, you can log on to CPS Magazine and get that. It's an email blast magazine that, again, talks a lot about products and materials. So, no, this is directly through me. My magazine is a partner with Shine. I write a lot of articles for the sales flyer, for the specialty flyer, and I do a lot of webinars for chairside assistants, really is kind of my main audience. So we'd love to have you log on, stay connected with us. And again, you'll see us. We also provide CE credits through the magazine. So I want to just make sure, and again, I apologize for not knowing all the scientific materials, but whoever asked me that question, you email me, I will definitely get you that answer, okay? And again, I love it when I see team members logging in from overseas, especially the Philippines. God bless you folks. I hope that things are okay there. I hope that you and your family are doing okay. Over here, we just think about you so much, and God bless you. We appreciate you being on for us. So at the close here, again, love to stay connected with you. If you ever should need me for anything, any aspect of your practice, I'm always available. I think that's what is so important, is for us to stay connected, become friends, and just think about all the areas that we can help each other. There's probably something you're doing in your practice that I might not know about that we can kind of share with the other team members along with us. We reach out to about 60,000 dental assistants and dental team members through our magazine, and so that's a number that we want to stay connected, because if there's anything that you can provide for us, please feel free to do that. I thank you again for attending this webinar, and I hope that you all have a wonderful evening, and I look forward to seeing you again at another Viva Learning webinar event. Have a good night.